So Pillars of Wellness, just very briefly, is an integrated care clinic out in the West End of Burlington, fully servicing a lot of different service needs and covers the MVA population as well, which we will gear more of our presentation towards that population. I like this quote because it's very much the background of why we opened up Pillars of Wellness and also part of why we partner with VoxNeuro. Healing is a matter of time, but it's also a matter of opportunity. And VoxNeuro has provided us an opportunity to service our clients better and to allow us to get more objective data. So that kind of jives nicely with our partnership. So in the presentation, we're going to go over just quickly about the clinic, our services and integrated care, a couple of the technologies that we have, and then we're going to spend most of our time shifting the floor over to the VoxNeuro team to talk about the cognitive assessment. And then at the end, we're just going to tie it together in terms of how we're using it clinically, how it's supported on treatment plans, how it can maybe be helpful for you in terms of moving clients from MIG to minor injury, non-CAT files, that type of thing. And if you have questions at all, just send them in the text box, and if they're relevant at the time, we'll deal with them then, or we may just push them to the end of the presentation. So I'm going to do a quick video here for you. I'm going to do a quick screen share again. This one? Yes. No. There we go.
Okay. So we're hoping that you can see the video and hear me. Chris, if that's the case, can you just give me a quick thumbs up? Wonderful, thank you. So as Lori mentioned, we are located in the West End of Burlington. We are a fully wheelchair accessible clinic. We're located on the main floor, accessible parking located right outside. Given COVID, we are being very careful of all of our personal protective equipment that we have. We're all wearing masks and gloves, face shields if necessary, gowns. All of the cleaning, is being done regularly. We have a variety of private treatment rooms as well as a larger gym space that can be converted into a bunch of different purposes. As you can see in the video there, I was offering pediatric classes prior to COVID. To be more mindful of some of our clients with traumatic brain injury, all of the lights in the clinic can be dimmed, including in the hallways, all of the treatment rooms, and the gym space at the back. We do have a change table for babies. We have a very large accessible washroom suitable for walkers and wheelchairs. We're offering in-clinic, virtual, and community care at this time. And we've done our best to really create a very calm and relaxing environment. Obviously, people are coming in here with some very sensitive issues. So we want to make sure that we're creating a space that is going to be conducive for their rehab. We offer a variety of services, as you can see in the video here. So we have occupational therapy for adults and children, physiotherapy, so there's a few of us providing orthopedic care, neuro, pediatrics, pelvic floor, and vestibular rehab, chiropractic care, speech therapy for adults as well as children. We have a counselor who is a master's of social work as well as a psychotherapist, again, servicing adults and children. We have a naturopath, again, she's comfortable seeing adults and children, an acupuncturist, a holistic nutritionist, as well as a yoga therapist. So we've done our best to try and encompass practitioners across the entire continuum of care, because that really kind of hones in on our integrated care approach, as Lori is going to chat with you about.
Perfect. I'm going to go back to a little screen share here. Okay, so just quickly, multidisciplinary care is often kind of used synonymously with integrated care. Integrated care essentially just means that we're looking at doing comprehensive, coordinated, seamless care, but it also comes from an infrastructure standpoint. So from the second the client walks in, we do integrate their care in the sense of providing them with the service where we can access each other's clinical notes, do joint assessments, joint treatments we often do as well to be more effective and efficient, and also let them ebb and flow between services. So I just put a quick slide here in terms of why you would want to go to more of an integrated care center. For the MVA population and for the purposes of doing an OCF 18, sending them to one facility where you can put a bunch of things on one treatment plan, and having clinicians that are able to just dialogue with each other in the same space, clinical notes that are accessible to everybody in that facility. It allows the clients obviously to be paying less money for communication time, less money for making many different treatment plans, and there's a lot less redundancy in terms of the assessment and treatment that's being provided. A lot of us under our scope of practice have a fairly broad scope of practice, so there is a fair amount of overlap, but when they're in a clinic setting where we're all in the same space, we can really minimize the overlap and really gear our treatment so that each practitioner is working to the best of their abilities towards the same joint goals. So it allows for the clients to improve faster, and it also allows them to kind of modify their treatment plan as they go along. So perhaps physio isn't working well for them. Maybe they need to do a bit of acupuncture or even yoga therapy. So they have that ability here versus having to send out referral here, referral there, and then hope that everybody is quite coordinated. A lot of us, like I said, do clinic and community, so it does allow for this transitional component as well. And I touched on it quickly, but I just wanted to highlight again the joint assessments. So if someone's coming in here, say from an MVA, and they have a concussion, right away we already know that likely occupational therapy and physiotherapy are required amongst other services, but perhaps they come in and they sit down with, for example, Jana and I. We review their subjective information. We find out where things are at, a lot of that historical stuff that typically they would have to say to Jana, then come another day and say to me. They can just say it to the both of us at one time. We can split to do our assessments, come back, her and I can communicate and come up with a good treatment plan. So the client is only having to tell their story once, and we're hearing the same information so we can work directly with the same set of goals. Teamwork is important here, so we all sort of support each other, and best practices is part of why we're doing this presentation. So as clinicians, our job is to deliver the best care we can, and to deliver the best care that we can, we need to be updated with the newest technology, the newest research, and that's the exciting part of VoxNeuro. They're part of the newest technology and the latest research. So they are supporting our concussed traumatic brain injury population quite well.
So just quickly, we do have a few other pieces of technology here at Pillars of Wellness. Today we're primarily focusing on VoxNeuro, but we just wanted to give you just a quick introduction to two of our other systems. So we offer what's called the PONS treatment. If you're not familiar with it already, it's a neurostimulating device. So the round piece there with the screen on it that you can see goes around the client's neck, and then the little piece is actually a mouthpiece. And it has a series of electrodes, and the mouthpiece goes obviously in the mouth on top of the tongue. And what it does is it delivers a low amplitude electrical stim to the tongue. And based on the research, we know that there's a variety of nerves from the tongue that have direct connections to the parts of the brain that control balance and gait and various other functions. So there's a very specific treatment protocol that the clients will follow while wearing the electrical stim device. It's a device that they take home with them, and the therapy is done multiple times per day, as well as with support from us. It's currently approved by Health Canada for use with traumatic brain injury and MS, multiple sclerosis. Anything outside of that would be considered off-label at this time. There's been some really, really great evidence and testimonials to how this device has helped people with their balance and their walking. So we're really excited. Lori and I are the PONS trainers here to be able to offer that program. And we also have a virtual reality unit, as you can see the picture there. So this unit is used for a variety of different reasons, primarily by Lori, who's occupational therapy, as well as our counselor. So it provides a really unique way to tackle a lot of different issues, mainly related to exposure. We can answer any additional questions that you have on that, but it's really, really cool. You can, for example, one of the more common ones that we would use is a driving simulator. So the client will visualize themselves in a car, and you can play with a lot of different variables. So you can add a passenger beside them. You can add a passenger beside them that's talking. You can change the speed that the car appears to be driving. You can add, you know, a country, nice calm road, or you can have them driving on a highway. You can have them drive past an accident. And while they're wearing the unit, they are also connected to a monitor that's going to keep track of their heart rate. So we have physiological measures of how the client might be responding to different situations. And then we have control on a separate computer to grade how challenging their environment can be. It can also be used by physiotherapy, such as myself, if we want to make the environment more challenging while you're doing balance exercises, vestibular rehab. So it's a really awesome piece of technology that we're really excited to have. And we can definitely share more with you at another time if you're interested.
Okay, so what you guys are primarily here to hear about would be VoxNeuro. So I'm going to share a brief video that we did jointly with them that's going to give a quick overview, less than 2 minutes, of the assessment itself to kind of let you visualize it, and then I will let the Vox team take over from there. So bear with me 1 second again. Oh, that's unfortunate. It's all right, wrong video.
Wrong video.
The glitches sometimes of this one here.
Yeah.
It's just
No.
Pillars of wellness, we always utilize a different type of treatment and assessment to help our patients with recovery with concussion or head injury. So it just made sense when we came across with VoxNeuro to just partner.
VoxNeuro's technology is a scientific breakthrough in brain health management. The Cognitive Health Assessment is the first objective brain health assessment that goes beyond a diagnosis, and it was specifically designed for physicians, nurse practitioners, and healthcare specialists to be used as an assessment tool. So the assessment actually helps the clinicians with objective data on a patient's core brain functions, and those are things like memory, attention, language comprehension, and executive function. So all things that are imperative to a patient's overall health and their independence.
Through a combination of non-invasive neuroimaging, a patent protocol, and advanced algorithms, VoxNeuro's cognitive health assessments are able to provide objective, direct insights into an individual's core cognitive functions. Specifically, VoxNeuro's cognitive health assessments use advanced EEG methods. These methods are backed by over 25 years of globally funded, peer-reviewed scientific research. These methods are used to capture an individual's neurophysiological brain responses. These brain responses, called event-related potentials, or ERPs in the science world, are direct reflections into an individual's core cognitive functions.
My main goal is really to help identify the best treatment plan. With VoxNeuro assessment, we have a lot more precise data to work with. As an integrated care clinic, we really want to get the best data as possible.
Okay, and I'm going to pass it over to the Vox team. I'm just going to pull up their presentation. Screen share still, probably.
No, I don't think so.
Okay, just do that. That works. Okay. All right. Hopefully you can see that presentation. Okay, so I will let Kyle and Chris take over the stage.
Thank you, Lori and Jenna, and thank you everyone for joining to learn more about all the great work that Pillars of Wellness is doing from a rehabilitation standpoint, as well as from an assessment standpoint. So I'll give a brief introduction. We'll go into the first slide about VoxNeuro and where VoxNeuro has come from, and then I'll let Dr. Kyle Ryder discuss further. So VoxNeuro is a breakthrough application. It's EEG-based neuroimaging. The focus that we've come to market with is on objectively quantifying the what was traditionally perceived as the invisible aspects of an injury. So how MRI and CT, and Kyle will dive into this a little bit deeper, but how MRI and CT are great at identifying structural abnormalities for individuals with brain injuries. What has really been lacking in the industry is objective measurements for how an individual's memory, concentration, decision-making has been affected. And typically these are the aspects of the injury that affect an individual's day-to-day life, but have been difficult to either prove from a legal perspective, or difficult to effectively create customized rehabilitation plans, because a lot of the measures that are available today are subjective in nature, which lead to errors in diagnosis, but also trial and error approaches to the treatment plans that are being put in place, especially in the first 6 months when it's very important to really hone in on specific areas of concern. So into the next slide. So I touched on some of these, but the subjective assessments that are out there today, a lot of the objective tools that are available, whether they be structural, they don't look at cognitive. There's a number of objective measurements coming out of the US and Europe that are focused on blood tests and rapid deployment of tests within the first 1 to 3 days of injury. And they're great at objectively confirming a diagnosis, but they're not able to quantify the specific areas of injury, and their utility stops at diagnosis. So we partner with rehabilitation clinics because we're really focused on empowering clinicians to identify those specific areas of concern. But with being commercially available for over a year now, and working in this space, we've now started to speak with and have a number of referrals that come through the med legal space, and so how leveraging these to showcase that there is an injury, and that and through follow-up assessment, where is that individual today versus 6 months ago, and have we seen an improvement, and can we use this to further justify additional coverage and additional benefits for individuals. Next slide. So this speaks a lot to the work that we're doing with our occupational therapists and rehabilitation specialists around them identifying customized rehabilitation plans. By customizing these plans, it's accelerating treatment and tracking recovery through follow-up assessments. We can improve the predictability by understanding, what areas to focus on and how those individuals should continue on their treatment plans when we do see improvements in certain areas through those follow-up assessments. Where clients really like to leverage, and our clinical partners really like to leverage this, is making sure that the limited amount of funds that are available for all these individuals, they're being utilized on the specific areas that these individuals need to use it from a rehabilitation perspective. And then the follow-up assessments, and again, to justify improvements or potentially new areas to focus on. So I will hand it over to Dr. Kyle Ryder to go through what is the assessment and to discuss how VoxNeuro is different from the assessments out there today, as well as how we're quite complementary to a number of different assessments that are out there today.
Awesome. Thanks, Christopher. So yeah, firstly, I'm just going to dive into, what exactly it is, what we're doing. So as Christopher mentioned, it is an EEG-based neuroimaging assessment. It is an assessment that is combined with computerized neuropsychological assessments, a couple traditional ones that clinicians are very familiar with. What we do is it's a real-time measurement of cognitive brain function. So it's a 45-minute assessment of actual EEG testing. There's about 10 or so minutes of general intake and behavioral forms for symptomatology, et cetera, and consent. The setup takes 15, 20 minutes, and then cleanup takes about 10 minutes. So all in all, the patient is required to be, there for about an hour and a half of their time. And then once the assessment is completed, what we do at VoxNeuro is the data gets put up into our cloud, and we take that data and then we run it through our proprietary data analysis methods and algorithms to produce the report that I will show you soon. And excuse me, we turn that report around in 48 hours. The last thing I really want to just highlight is the fact that we do not require a baseline like many other assessments in this kind of realm. The reason for this is because we have a large normative database of quote unquote healthy brains and age range of about 12 to 90 years old. So we can compare the specific client's brain function to that of their age. So we can have a direct comparison between how that person is doing today in their different cognitive functions relative to the average for that age group. So we can move on to the next slide, please. So these are the different core cognitive functions that we measure at VoxNeuro. So these core cognitive functions that we measure are the ones that are most commonly affected by brain injury, whether it be more mild traumatic like concussion or more traumatic and more severe. So these include executive function, language comprehension, working memory, a couple different types of attention, visual and auditory processing, concentration, and information processing. So how they look like on a report. So here's a sample front page report, part of our report. So this is a summary. There's 3 or 4 additional pages that are added into the report, but everything you should need to know is on this very first page. So I'm going to highlight first this complex functions response graph here. And you can see that each of those core cognitive functions, the 2 attentions, concentration, working memory, and executive function, all are within that graphical wheel, and they're within 2 different domains. So each one of those pie pieces is one of the cognitive functions, and each number represents the percentile that they rank relative to their age range. So these percentiles for VoxNeuro are bucketed into 3 different categories. We have normal, so the healthy range, which is 75th percentile and above. We have a moderate deficiency, which is the 25th percentile to the 75th percentile. Anything below that 25th percentile is considered a severe deficiency. Now, we're able to, bucket these individuals into these categories because not only do we have this healthy normative database, so we know where the healthy range falls, we also continuously collect the data of those with a brain injury. So we have the other database of brain injured individuals that helps us identify where brain injury individuals fall and where the healthy individuals who have not sustained any neurological issues in the past fall. Now, I just want to touch upon, you can see there's 2 sides of this graph. We have response time and response strength. So we measure each cognitive function in 2 domains. Response time is quite literally how quickly you are able to perform the cognitive function, and response strength is how well you're able to perform the cognitive function. So simply, one is how quickly you can do it, so it's really information processing. Response time is equivalent to information processing, and then response strength is how well they're able to do it. And then just also the base functions checklist there, we have auditory processing, visual processing, which I mentioned before,
information processing, and language comprehension. We're looking towards in the next year to move language comprehension into our complex functions response graph. Today, it's a binary, do you show the response or not? But as we move forward and we have collect more data, we'll be able to be just as precise as we are in our other cognitive domains. So now if we can move to the next slide, perfect. So at the bottom of the summary page, you'll see one or two tables. So depending on which follow-up assessment it is, if it's a follow-up assessment or if it's an initial assessment. So each assessment will always show where these cognitive functions fall in plain language, if they're in the normal range, the moderate deficient range, or the severe deficient range. Follow-up assessments then will show an additional table that demonstrates, did these cognitive functions improve? Did they remain consistent, or did they decline over time? And this really helps to empower the clinicians to know, how their rehabilitation is going, but it also shows you as their client, how their recovery process is going and whether they need additional funding and services throughout their throughout the recovery process. You can move to the next one. And then if you prefer, if you're more of a visual learner, we also provide a progress tracker in a graphical form. So you can see throughout all different time periods of when the assessment was conducted, how they're doing for each time. So where they started, have they improved, how far they improved, etc. So now I'm going to talk about the difference that VoxNeuro brings compared to what is typically used in the medical legal world today. So as Christopher touched upon, we have MRI and CT. This is a structural assessment. It is not a functional assessment. It does not measure cognitive function. However, it's very objective, it is very reliable, and it's a diagnostic. It does not inform rehab, and you typically want to have this assessment done immediately after injury. That being said, there are other cases where you want to have subsequent assessments done, but typically you want immediately after injury. And this is really good for measuring, as Christopher mentioned before, again, any kind of brain bleeds or inflammation of the brain. Then you have second here is the neuropsychological assessment. So obviously this is not a structural assessment, it's not a neuroimaging tool, it's not a functional assessment. However, it does draw insights into the cognitive function of an individual. That being said, it is technically subjective in nature, as it is an individual sitting with a client or patient and assessing their cognitive ability through traditional pen and paper tests, as well as looking into their mental health, their symptomatology, etc. Is this data reliable? It has been shown that it is quite reliable, but there's obviously still that subjective nature, so there is some biases that could occur. It's typically used as a diagnostic. It does help to inform rehab. However, typically what happens with a neuropsych is it's usually done 6 to 12 months post-injury. And what also it happens is, you get about a 24, 25-page report. It's very in-depth, very complex, and you really have to kind of know what you're doing and read through the entire report to get the benefit out of it. Now, the next one I do want to talk about is Fmri. So this is functional magnetic resonance imaging. Despite its name, it doesn't measure cognitive function. It's not a structural assessment. It is a functional assessment in the fact that it measures the amount of blood oxygenation levels in the brain and where the oxygen of the blood flows to in the brain during a specific task. So it has been regarded as objective. There's a star there for my next comment in terms of its reliability. There's been a recent publication that just was put out in 2020, and this was put out in Nature. And if you're unfamiliar with the peer-reviewed journals, Nature is incredibly high. It's a really good journal, and they have just revealed that there's a significant lack of validity and reliability in Fmri data. So essentially what they did is they sent out the same data set to 70 different lab locations, and they came back with 70 different answers of what that data was saying. I just wanted to highlight as I know Fmri has been used in the legal setting. I know it's not super common, but I'm sure there's at least one lawyer here that it has been used in. The point is, this particular study, and the study was done by individuals who have run Fmri studies for the last 20-25 years, have shown that it's just, at the moment, it's not reliable. And this is because there is no standardization process of how to process the data. So just moving on from that, typically it has been used as a diagnosis, at least in the medical legal world. It does not inform rehab, but you can use this at any time. So the difference with us, with VoxNeuro, is, at least in a couple different domains. Of course, this is not structural. We're not telling you your brain's structural integrity. This is a functional assessment. We do directly measure cognitive function, and this is an objective measurement, and it is reliable. And this is based on, we do have a standardized process. The standardized process is also well known throughout the research world. It is backed by over 25 years of research, like Christopher mentioned, and it's Health Canada cleared already. Purposes here, we are not a diagnostic. We're not trying to be a diagnostic. We are an assessment tool. We are here to help your client know what the issues are, or what issues they're having due to their brain injury, and to help inform the rehab for the clinicians to help them get better sooner. And the real benefit of our assessment is that it can be done anytime post-injury. It can be done 30 years post-injury. It can be done 3 hours post-injury. So this is kind of just a comparison of how we differ from the other types of assessments that I know are typically used in the medical legal world today. Now, that being said, although we are different, we are very complementary. We can add a layer of objectivity to a neuropsych assessment. And typically what we see is we do align with what the neuropsychologist assessment or neuropsychological assessment finds. There are the times that it doesn't, it happens, but typically we support what the neuropsychologist finds and provide that objective data. And then, as Christopher mentioned at the beginning of our presentation, is that we provide objective data on what used to be considered that invisible injury, the cognitive function issues, because we can measure that at the neurophysiological level. Now, I've already touched upon the other ones, but we are very complementary to Mri and Ct. It's important to know the structural integrity of the brain. We are very complementary in neuropsych, as it's important to know the individual's behavior, their symptomatology, their mental health, and their cognitive ability in terms of pen and paper tests. So we really just think that, though we differ, we're not really trying to replace anything. We are really being complementary to what is currently being used in that medical legal world. And I'll hand it off to Christopher now.
Perfect. Thanks, Kyle. So yeah, just some points to reiterate, and may answer some questions that we'll get to after the slide. We are based on, VoxNeuro is based on 25 years of globally funded research, has been cited in over 300 plus peer-reviewed publications. This was first validated from a severe traumatic brain injury perspective back in the late 90s. A lot of work has been done, especially over the last decade, in stroke, mild traumatic brain injury, concussion, and has become commercially available. So been taken out of the lab and become commercially available since June of last year. We are a Health Canada cleared service, and in the last 12 months, and working with our partners like Lori and Jenna, we have seen coverage through individuals' motor vehicle accident insurance benefits, extended benefits, and working with workplace insurance as well. So we'll leave this slide up. Just some words from Lori that you can read. I won't reiterate them. I know she can speak to how they're leveraging it within the clinic as well, but did really want to take, I think we've got just over 20 minutes here, to turn it over to all of the attendees that may have any questions, either about Pillars of Wellness and any of the services that they offer within the clinic, as well as for ourselves at VoxNeuro.
Yeah, and maybe just a little preamble from myself. So since we had partnered and we integrated the assessment into our clinic here, as the occupational therapist, I'm typically, you know, one of the first service providers in, or, you know, brought in shortly thereafter. And I have been integrating it into all of my sort of neurocognitive OT assessment treatment plans. So the treatment plan looks the same, you know, it's within the guidelines of what you can bill per assessment, but VoxNeuro is now a line item that I add in there. So I'm still doing some cognitive testing, but the VoxNeuro Cognitive Health Assessment takes a big piece of that, and then I do a smaller portion, because within the assessment, I don't know that we talked about it, we do cover off a bunch of subjective questionnaires, which I would typically do in my treatment and my assessment protocol anyway. So it's well captured. So I have been integrating that report into all of my recent assessments. In my attendant care assessments, I do add it in if it's possible, and they have an identified concussion or suspected concussion from their accident, to give that extra objective data to you guys, because you know, we do have some clients that are considered to be in the minor injuries and really shouldn't be. And then we do have some clients that are non-CAT, and their head injury or their concussion hasn't been well recognized. So I have been using that assessment to sort of further justify that there are objective challenges. And I usually back that up with some additional, maybe more specific assessments on my end. But we have had really good success with it. I have put in the Vox assessment as a standalone in a treatment plan as well. I do attach a fairly large description in the last page about what the Vox assessment is, what to expect from it. And so far we've had pretty good feedback with it. I know our other clinicians also utilize the information from the report. So in our center here, I mean, Jana can speak to it, but if we do our assessment and it comes back that the client has really big challenges in concentration and working memory, for example, Jana changes her treatment to make sure that everything she does is written down for them, that she breaks up her session times so that they have a bit of rest break before they start their next task. So it is informative to the whole team, but it's that objectivity, because sometimes clients' symptoms are so strong that my testing results are skewed based on fatigue, eye sensitivity, headaches, and I never know for sure, is it really their cognitive functions that are failing, or is it their symptomatology that is coupled on top of that so strong that I can't really tease that out. So this has been helpful for teasing out some of those more challenging situations. I just want to make sure I didn't miss any here.
I don't think we got all those.
I think we have them all.
There.
Okay, so if anyone has any other questions, I mean, you can always reach out to Vox directly with Chris or Dr. Reiter. And then Pillars of Wellness, obviously, we're always happy to answer questions of anything related to Vox, or also how to integrate that into existing treatment plans or what that might look like. Is there anything else you want to add?
And just in terms of, you know, scheduling, like we kind of mentioned the price point, we are more than happy to get people booked in like relatively quickly. So even hypothetically, if we were to look right now, we would have multiple openings at different times of day to accommodate whether someone is more fatigued in the morning, maybe they're a little better at night. We would be able to get them booked in within a week or two, and then the results come back within 48 hours on business days. So the time to schedule the appointment, the turnaround time is very, very quick on our end as well.
Yeah, and Dr. Ryder obviously is doing the report and all the analytics on his end. Typically what we do is we book the assessment, we complete the assessment, and then 3 or 4 days later, we book a follow-up with the client. So that gives me time to get the report from Vox. I review it either with the referring practitioner. So if someone had referred them for the assessment and they want to go over the results with the client, then I would connect with them. I would review the report, help them understand it, and let them then review it with their client. Or if not, I would book an in-person or a phone or virtual session to review those test results with them so that they could fully understand the report. And like always, if there's any further issues or, you know, little technicalities that they want more information, Dr. Ryder is always accessible to kind of review that in more detail if needed.
Yeah, obviously with something new and a new style of report being made available to, you know, to your teams, whether on the clinical side or on the legal side, we're always available after this call to go through, you know, your client's results, answer any questions, and ensure that the report's being properly interpreted, and that you know, you're comfortable with understanding of the report. So we always stand behind our product, and we'll always be available to answer any of those questions. And each individual report, as I had stated earlier, does come with a report authority from our team that would be best capable of answering individual results.
Yeah, so we're just going to add in the chat here so everyone can see, we're going to add the Pillars of Wellness generic email. It's usually Lori and I that are monitoring that inbox very closely. So if you do have any broad questions, or you're wondering how to get connected with Vox, or if you just have any other questions, we're going to type that into the chat here.
And we're obviously set up with HCI, so if the referring clinician or whoever is not able to put that on one of their existing treatment plans, then we can also do that here to make things simpler as well. So we're sort of set up to be able to facilitate in any capacity. So we just want to thank everyone for attending. Hopefully this was helpful and interesting. I always get excited to hear Vox do their talk on their technology. We're a big fan of technology here and research. So if you have any feedback for us, good, bad, or ugly, let us know. Otherwise, thank you so much for attending, and I hope you guys have a great rest of the day.
So we have been recording this webinar. So we're hoping that we'll be able to have snippets of it. Sorry, I just saw a question pop up there. If you're able to get a copy of the meeting. So just send us an email if you are interested in more information or a refresher on what we talked about today. And we'd be happy to facilitate that for you. On behalf of Dr. Ryder and Chris and Lori and myself, thank you so much everyone for attending. And we look forward to hearing from you more and working with all of you.
Awesome. Thanks again.
Thanks, everybody. Great job.
Thank you so much.
Thanks, everyone. Thanks, Lori and Jenna, for hosting.
No worries. Thank you.
Have
Bye-bye.
a great day.
Bye.